Hi, and welcome to our weekly live question and answer session. We are here answering your questions. I have Dr. Rita Ellithorpe, our medical director. We're streaming to you live from Tustin Longevity Center. We are a private medical practice in Orange County, California, where we practice functional integrated medicine, which is really just combining the best of allopathic and preventative medicine to do what we feel is best for our patients. We meet here every single Wednesday at 9:45 a.m. Pacific. We're the only place I know of that sits here for a half an hour and answers any and all questions that you may have with a physician for half an hour. So what we ask you to do, we want this to be an interactive event. We're here to answer your questions, and you can do that here on the right in the chat section. If you post your questions there, we're monitoring that, and I'm going to ask your questions to the doctor. And each week we also bring a little bit of information just to fill the time on current events or some trends that we're seeing in healthcare. So Dr. Ellithorpe, how are you doing today?
I'm blessed. I'm doing very well. How are you?
Doing great, thanks. We have a couple questions already coming in, and I actually have one that was emailed to us here at office@tlcdoctors.com. So if you cannot log into YouTube, if you're having any trouble there, you can email us at office@tlcdoctors.com and just let us know this is a question for the live Q&A, and I'll bring that to the doctor as well too. So do you mind if we start off with this question?
Right, but again, the answers that I give, hopefully I have the answer. I'll tell you if I don't know the answer. I'll ask you to send me more information as well. But this is not meant to be personal medical advice to anyone. This is a service to our community of patients. There's 5 of us clinicians here working, and we just thought this would be a nice way to have a weekly means of communicating.
Absolutely. This is meant to be general information, not specific medical advice. We do offer that, of course. We're in the business of medicine, so you can schedule an appointment with the doctor to talk about your specific questions in detail, but general information, right?
Right.
Okay, so our first question comes to us via email from Gabriella, and Gabriella asks, my daughter's trying to have a baby. It's been difficult for her because she has endometriosis. She wants to do in vitro fertilization. What would you advise someone in her situation?
Well, if you go to tlcdoctors.com on our website, we have blogs, and Dr. Kaur is very proactive in giving advice and instruction on pregnancy, fertility, and such. So if you go to our website, tlcdoctors.com, and look at the blog she wrote on this, essentially what she is talking about there is endometriosis is the excessive growth of estrogen-sensitive tissue that normally resides in the lining of the uterus that fluctuates every month. It proliferates, and at the right time of the cycle with ovulation, then it triggers the shedding and a normal menstrual cycle. As you ovulate, progesterone is produced. That progesterone is a trigger then to help the lining of the uterus shed to get ready for the next month potential cycle of a pregnancy. The problem in our culture is we eat so much sugar and carbohydrate and fruit sugar and processed food, drink too little water, we're too sedentary, and we eat a poor nutrient diet, so we're calorie excessive but nutrient deficient. And this food, the starchy, fruity carbs, stimulates another hormone called insulin. And this insulin stimulates the growth of fat, the growth of tumors, tissues, and even the growth of endometriosis and polycystic ovarian syndrome. It is a function of what we call insulin resistance syndrome, or what was called the metabolic syndrome. And this is the proliferation and excess of stimulation from an insulin hormone from a high carbohydrate diet. Fasting is a wonderful way to quickly reverse this. There are many types of fasting. Again, if you go on tlcdoctors.com, you can see our blogs on this. You can see our video series here in which I do a whole hour-and-a-half lecture on sugar toxicity. And we talk about how you can do fasting to help stop this excessive hormone stimulation of insulin from the high carbohydrate diet which impacts the endometrium, okay? And those implants that come and are in the rest of the abdominal cavity. So a very low carbohydrate keto diet would be the direction, intermittent fasting, full day fastings, plenty of water. We would recommend certain nutrients. Vitamin K2, which is in most all of our vitamin D supplements, is noted to be the hormone of fertility. Vitamin K2, not vitamin K1. Vitamin K2 is produced by animals, cows, especially in the first grass of the year, the first clover of the year, the goats. When they eat that very first crop of grass, it is very dense in the production and rich in vitamin K2. Not that it isn't produced year long, but when the cow processes the very early spring grass, its milk and cheese products and beef and organ meat products are very high in vitamin K2. And this was traditionally saved the cream for all the young men and women of the communities in ancient cultures for fertility. Vitamin K2 with vitamin D would be something I would take. Mineral deficiencies, selenium, zinc, iodine, salt, these are very important. So we have a multivitamin called Mitocore or TLC Energy Core. This is what I use as my prenatal for all my pregnant women here. So I put them on Mitocore, I put them on vitamin D 5000 with K2, and then I put them on iodine, the iodoral, 1 tablet a day. And I put them on Juice Plus. Mm-hmm. Juice Plus is a powerful antioxidant, anti-inflammatory, because endometriosis is an inflammatory syndrome. Insulin resistance is a chronic inflammatory syndrome created by the high carbohydrate diet. I think if you do all those things and then take enzymes, systemic enzymes help clear away this abnormal endometrial implants in the abdominal cavity that makes it sticky and so forth, and creates a lot of cramping and so forth. So I would take systemic proteolytic enzymes on an empty stomach first thing in the morning and last thing at night, and I would never eat past 6 or 6:30 p.m. ever at all. And that should greatly help her.
Anything you want to say specifically about the in vitro fertilization? Is that maybe a last resort or something that we would do in conjunction supporting a patient?
Well, I don't know her age and
right.
how much time she has. So I would say if she's an older woman, her number of eggs is diminishing,
Sure.
okay, with time. And another thing she might do is use progesterone, which is a cream that we have here, and I would use it day 15 from the start of her menstrual cycle to day 25. It won't stop her ovulation, but it'll help augment it. So if a egg is passing, it'll help the likelihood of that sustaining pregnancy to take,
right.
Okay? In vitro fertilization is fine and decent. We have specialists, fertility specialists, who help with this. But I would think using the progesterone cream day 15 through 25. And by the way, ovulation is stopped when you have a high carb, high sugar, high fructose, high processed food, high sugar drink, latte, frate, whatever you're drinking. That promotes the insulin resistance syndrome, which inhibits ovulation.
And how about stress?
And stress. Another thing is, if you want to keep your ovaries, your whole body younger, longer, probably the number one thing would be the Juice Plus. Because of its much research, there's at least 40 different peer-reviewed articles on the multifaceted anti-aging, anti-DNA damage, anti-inflammation impact of Juice Plus on the body, which means it'll help keep the ovaries younger longer.
Right. And if I could just add to that a little bit from personal experience and experience with my friends, I refer people here to come and talk to our doctors, either Dr. Kaur or Dr. Ellithorpe. They're Dr. Kaur, sort of known as the baby maker doctor here at the office. She's gotten a lot of women pregnant that were struggling with that.
Mm-hmm.
But whoever is coming here has got to be prepared to jump in and listen to the doctor and follow their advice, not sort of treat it like a buffet,
Right.
a la carte. I'm going to try this, I'm going to try that. So be prepared to really look at your lifestyle, your diet, your nutrition, your stress, your hormones, and make the change. And we have great success with fertility. So absolutely, I've just heard so many stories of women that tried for years to get pregnant and followed what our doctor said to do here without surgery, without in vitro fertilization. Not that there can't be a place for that and we can augment that, but just huge success. So Gabby, check out that blog post at our website, tlcdoctors.com. Send that to your daughter. And I'd really suggest, since there are so many factors that affect fertility, suggest that she come and see one of our physicians here, probably Dr. Kaur, to talk about her in detail. Okay, great question. I love talking about fertility. Okay, got a couple questions here from Mr. Robert. I'm concerned that for-profit preventative treatments and prescription drugs are going to keep advances in medicine from occurring. If chelation eliminates most heart attacks and strokes, there will be unhappy doctors and hospitals who would lose their customer base. How do we solve that problem, or is it solvable?
Well, the truth needs to prevail. I don't know how to solve that. I'm in a quest and have been. I've been around EDTA chelation since I was 7 years old, when I saw my own grandfather dramatically healed from unstable angina. Unstable angina is where you have chest pain at rest, sitting or just standing. You're not exerting yourself. And that's the very ominous signal that I saw him pop his nitroglycerin tablets back in the 1950s, late 1950s, because that was the only treatment there was really available medically. And after he got chelated, he had about 40 treatments and then did a maintenance of this. He lived on to see me go to medical school. So I was 7 when I recall that vision of him clutching his chest and putting that into his mouth. And that, I guess, stuck with me all my life. And so what do? We talk, we share, we write blogs. We go to medical conferences, we do lectures, we share these lectures. I have a great lecture on our website on the truth about chelation therapy. Now, Dr. Tony Lamas, his first name really is Gervasio, but we call him Tony. He's the cardiologist at Mount Sinai in Florida that conducted the TAC trial. Dr. Gervasio Lamas is a cardiologist, and he was not for chelation, he wasn't against chelation, but he had so many patients in Florida, and that's where my grandfather lived. They asked him for chelation, so he said, I'll do a study. And this study was financed by the National Institutes of Health. It started in 2002, it finished in 2012. And these results, the trial to assess chelation therapy, called the TAC trial to assess chelation therapy, was a phenomenal success. And it demonstrated that along with standard of care of the cardiologists, the addition of EDTA chelation with a high-dose multivitamin mineral antioxidant that we give had the best and statistically significant results that no one drug alone could have done. And so what I would say is Dr. Lamas hasn't stopped his practice of cardiology, and not all.
There's still going to be heart attacks
all
and
other kinds,
cardiovascular
yes.
events.
Should we all eat bad so we keep cardiologists working and all diabetologists working? No, we all should ultimately work toward a healthier people, a healthier situation. And I would say we need less specialists then, and we would have more generalists. Yes. Now, I'm a generalist, I'm a general practitioner, and if we keep the population healthy, maybe that income can go into better research or education or infrastructure, but everyone will stay busy, everyone will work, but please share, and share.
Yeah, on the note of sharing, if you're finding this to be valuable, please do us a favor and like the video, subscribe to the channel. That really helps us out. And let your friends and family know about it. I don't know anywhere else you can go weekly and ask a doctor for free for 30 minutes any questions you like. So help us spread the word. Next question is from Emmanuel. Would you say a little bit about overcooking food? I'm unsure of scientifically where that would in the cooking process. So it sounds like they're talking about cooking food, maybe losing some of the nutritional value, raw versus cooked. What do you have to say about that?
Well, let's put it this way. If we're genetically modifying the food and we're eating a lot of it, it doesn't matter to me whether you cook it well or not well and keep it raw, it's still damaging. So there are so many levels to address in food cooking. But in general, I try to slow cook my roasts. I never use a microwave. It is essentially it's the enzymes that are destroyed.
Or the fats when you heat fat up too much.
Well, fat is saturated, so fats are not damaged by cooking.
What about frying?
Well, no, that's a different thing.
Okay.
If you're frying in lard, that's safe.
Okay.
If you're frying in the vegetable oils, that's health damaging. Okay? So there's lots to talk about here, but it's the enzymes of the food that are destroyed with heat. So slow cooking and slow roasting is the way to go. I believe in having, a live salad like I had yesterday with my chicken. So my chicken is slow roasted, and there you have it. So yeah, you can overcook food and destroy the enzymes there, but you're going to still get the mineral nutrients and many of the other valuable proteins and fats and so forth. So yeah, you're sneezing too. See, he's my son. And we're both be positive, and
Wednesdays are gardening days.
And they're gardening out here and gardening at my home, so it's hard.
I hope that answered your question, Emmanuel. We have a question from Deborah. What areas of integrative health can impact many of the behavioral mental health issues? I work part-time for this type of clinic and believe I could share some general information to the doctors.
Behavioral health is connected to the gut. There is a gut-brain connection. This has been well studied. Now there's new research that
brain to gut.
Yeah, the brain to the gut versus gut to brain. I write that upside down. Okay, but there's a two-way pathway. They just did some recent studies on mice where they took meningitis, I believe it was, and they put it in the stomach in the food. Rabies? Was it rabies? And they put it in the stomach of these rats, and they found that it ascended to the brain using, I think, the vagus nerve, which is a connection to your brain. So eating foods that are rich in things that repair the cell membrane, because your brain is about 75% fat, and we're eating a hydrogenated trans fatty acid, genetically modified, inflaming high-carb diet, then the brain is going to be missing what it needs in that double layer of fat and protein membrane, because all the membranes are fat and protein. They're not made of carbohydrates. So what we do wrong is, in all health, in hospitals, but especially mental health, the brain needs a lot of fat. That's why we created that Great Bar. Right. Doctor's Nutrition Great Bar is absolutely fantastic, filled with the essential fatty acids that are needed for cell membrane repair, but especially the brain. It's satiating.
Our brain is mostly fat.
Right, it is.
And we're eating mostly an American diet of fats that have been destroyed.
Right, through hydrogenation of those fats, so they extend the shelf life.
And then we've given fat a bad name, so people are avoiding fat, so we have a double problem. Those small fats that we are getting are bad fats, and we're eating less of the healthy fats.
Yeah, see, they're mislabeling things in biochemistry and chemistry. I don't think they're giving enough or requiring enough biochemistry of pre-med students and medical students, so that I think a lot of doctors are not aware of linoleic acid and alpha-linolenic acid, which are an omega-6 and omega-3 fatty acids that are the only two essential for a human being. And these are rich in animal foods and egg yolks and nuts and seeds. But you hear all this about omega-6 damage, but the problem with omega-6 is they hydrogenate the fats to damage the omega-6. So the preemptive statement should be damaged omega-6s are bad for you, okay? So you see there's, our educational system is failing us, and I hope we can recover it.
Right.
But hopefully you'll understand the brain is mostly fat, 75% fat. You got to eat that fat, and we've been frightening everyone from eating this. So the membranes have a lot of damage to it, and they're more irritable, they're more sensitive. So fat is calming. Just think of a baby drinking that fat-rich milk and how relaxing that is. So, and then I would give them Juice Plus, I would give them vitamin D, which is a natural antidepressant.
How about the microbiome in the gut?
Well, yes, the good bacteria are associated with helping to make serotonin even in your gut. So a healthy gut program would be very valuable as well.
Yeah, it's an exciting frontier. There's a lot of research going on and talk about the connection between the brain and the gut. And if you think about it, it makes a lot of sense. I've heard as high as 80%, sometimes even a little bit higher, of our immune system lines our gut, and also we have more bacteria in our microbiome than we have cells in our body. We're outnumbered.
Right.
We're outnumbered. So there's definitely something going on there. I'm thinking about a book by Perlmutter, not Grain Brain, which is a great book, but
yeah, I know what you're talking about.
No, Grain Brain. Wheat Belly was the first one. So Grain Brain is a great book that I would refer your doctors in mental health if you're interested in that concept of how food can affect our mood.
Mm-hmm.
Yeah.
That's a huge topic. So diet affects your mood.
Absolutely.
And alcohol affects it. It'll affect your sleep at night. So I would talk about those things. Look on the blog there, because we do have quite a bit about gut health and repair. We have a lot about toxic sugar. And I believe all this sugar is promoting some of this dementia, Alzheimer, cognitive dysfunction, because the tiny capillaries to the brain are all being clogged up by these sticky carbohydrates and food allergy complexes.
We're getting a lot of really quick questions in here, and if we don't have time to get to these all today, I'll make sure that we save these questions and we bring them up next week. But just rolling right into the next question, is it okay to use nutritional yeast in recipes if I had candida?
Yes, yeah, absolutely. Candida can only thrive if you're a high carbohydrate eating person. So if you do intermittent fasting or a full day fast once a week, and your blood sugar fasting is under 85, your insulin is around 3 or 5 fasting, and your triglycerides are in the 50, you don't have to worry about yeast in your food products.
Right.
For the most part.
2 really great items that I know that our doctors recommend here, the Candicid Forte and Intestinol, that help to combat that candida.
Mm-hmm.
Next question. I recently had my blood work done and vitamin D levels were 20. Would vitamin D3 K2 5,000 IUs a day be enough to build up my levels?
I always respond to the concept of repairing a road that has a lot of potholes in it. So if you have a bad road with a lot of potholes, the paving company comes along and they bring in a ton of paving, but they fill all the potholes. And so if you just take vitamin D K2 5000, you may not budge that D20 for a long time. So what I would suggest is you use D10,000, okay, with K2 daily for about a month, and then retest and see if that lifted it up more. You might need even more than that. So this low dose and fear of vitamin D is foolishness in my opinion. Let's get higher levels. You got to fill in those potholes already that are needing the vitamin D, and then we can eventually get to a maintenance of maybe 5,000 with K2. But you need to have a doctor check your blood.
And what serum level of vitamin D do you like to see at least on your patients?
I like it around 80.
Okay. Going back to the topic of food real quick, what are your thoughts on air fryers?
I'm not familiar with air fryers.
Those are those little ovens that use circulation of it. It's like a
convection. Yeah, I love them. I have the new wave. I have 2 new waves, so I do. Yeah.
I don't know why you have 2, but she has 2.
It was 2 for 1. Get 1, buy 1 free. And so I use my Airwave all the time. I don't fry in it. I never think of it as frying. And I just think that's wonderful. It's got radiant, it's got the fan, and it's got just the heat. So yes, I like those.
Okay. Next question is, I was on Prilosec for several years, and after the recall, I decided against doctor advice to stop. I started Bragg's ACV, is that apple cider vinegar,
Yeah.
and after a few months was able to heal my symptoms of GERD.
Wonderful.
Great. Next question, I have gallstones and not breaking down my fats too well. Also, my progesterone and estradiol have zeroed out. My digestion is very bad and moods need help too. So I don't see a question in there, but so you have that patient presenting with those symptoms. Where do you start?
I start with the gut. Gut health is the most important thing. I need to know your blood type. If you're blood type A and you're not digesting well and what your age is, I would need to give you orthodigestzyme, and it has some ox bile in it that helps with the
break down the fats.
Yeah, which will help the gallstones. I would use systemic enzymes. I would do some intermittent fasting. I would talk about your sleep cycle to see what your hormone levels are, whether you're entering menopause or postmenopausal. So there's so many things to address in something like that. But healing starts in the gut.
Absolutely. Great question. Another one just came in here. A little bit of a provocative question. I heard that COVID-19 virus is mutated and it's not as dangerous anymore. Do you know if that's true?
Well, there's a lot of articles, I don't have my little table today, implying that the strength of the COVID-19 today circulating, and there are various strains. So we're not talking about one virus, we're talking about a whole diagrammatic family of this progressing worldwide. And there's different themes out of China where it started. There's an A type towards Europe, there's a B type, C type, and so forth. And the answer is yes, they're coming up with statements around the world. Virologists, infectious disease specialists are starting to say the load of viral particulate matter and the severity of it is diminishing. So there are several publications on that. That's true.
Okay. Great. We're just about out of time, and we don't have another question. Oh, wait, yes, we did. One more. Do you recommend treating for Lyme with only 2 bands? I have been told it's a non-issue. Have high ANA.
Lyme's?
Yeah, do you recommend treating for Lyme with only 2 bands? I'm not sure what you're asking there, Deidre, so I know we're short on time, so...
That's probably 2 different types of antibiotics. There's a series, just like tuberculosis is a multi-antibiotic drug therapy, and my answer to that is yes in general. Yes, I do.
Okay.
Well, lots of articles. Maybe we'll get to some next time.
This is a follow-up to that question about the gallstones. Late 50s, ox bile question mark. To break down the gallstones, don't know blood type, but willing to try intermittent fasting, but definitely need to get rid of the stones. Also had uterine-only hysterectomy.
Well, you know, a single large gallstone traditionally can be lived with. So you should see a general surgeon. People who have gallstones, I look to see if they're small, multiple little stones, because a little stone can get stuck in the cystic duct and create an acute life-threatening infection and emergency. Those who have a big, large, single gallstone are not as concerning, but you need to have a general surgeon who knows you, who knows your situation. God forbid it gets clogged, then he knows you and you can go to the hospital and no one's surprised. But so you need to be followed and you need to be seen by a doctor who can watch that, have a surgeon on the standby who knows your situation. If I don't recommend this, there is this liver flush. People think that it dissolves gallstones. I've been doing this over 40 years. I have never seen the liver flush get rid of gallstones, okay? So it's not to say there isn't some maybe cleansing or health benefit, but believe me, please don't fall for these statements that says I got rid of my gallstones with a liver flush, and they show the stool with these floating things in it. That's micellization of the fat when they drink all that olive oil with it. So don't go down that route.
Okay. Well, we're just about out of time. Did you want to say something about this, or?
No, there's just too much going on.
We always come prepared with information, but I'm glad we had a lot of questions today.
I do want to just point out that there was a retraction of the New England Journal of Medicine and the Lancet publication for May 22nd that put disparity on hydroxychloroquine as having no effect, and this is what stopped the World Health Organization from continuing the study they were doing on hydroxychloroquine. So there's a lot of intrigue and concern about how these two articles got published in the Lancet and the New England Journal of Medicine. It just shows you, that corruption can reach all the way to the top, So they have retracted them, and they've now resumed the hydroxychloroquine trial. So every week I'm studying all the time, and maybe we can talk more next week about this.
You never cease to amaze me. Well, Dr. Althorp does have a patient right at 10:30, so I've got to get her wrapped up and on her way. Thank you so much for joining us today. Again, just do us a favor if you're finding value here, like the video, subscribe to the channel, and please tell your friends and family. Invite them to come and join us next Wednesday at 9:45 a.m. Pacific. Bring any questions. Doctor will do her best to field them all.
I'll
Thanks
try.
for your time, guys.
Thank you.
Have a wonderful week. Ended.